Graves' disease is an autoimmune disorder that primarily affects the thyroid gland, causing it to become overactive and leading to an overproduction of thyroid hormones. The thyroid gland is a small butterfly-shaped gland located in the neck, and it produces two main hormones, thyroxine, T4, and triiodothyronine, T3. These hormones influence nearly every cell in the body, controlling how quickly the body uses energy, makes proteins, and regulates body temperature. In Graves' disease, the immune system mistakenly attacks the thyroid gland, causing it to become overactive and produce excessive amounts of thyroid hormones. This overstimulation leads to an enlarged thyroid, known as a goiter, and a variety of symptoms related to an increased metabolism. The name Graves' disease comes from the Irish doctor Robert Graves, who first described the condition in the early 19th century. Graves' disease is relatively common, affecting approximately 1 in 200 people in the United States. It can occur at any age, but most commonly develops in people between 30 and 50 years old. Women are much more likely to develop Graves' disease than men, with a ratio of about 7 to 1, and it also tends to run in families. Causes of Graves' disease. The exact cause of Graves' disease remains unknown, but several factors contribute to its development. At its core, Graves' disease is an autoimmune disorder, meaning the immune system mistakenly attacks the body's own tissues. In this case, the immune system produces antibodies called thyroid-stimulating immunoglobulins. These antibodies mimic the action of thyroid-stimulating hormone, TSH, which is normally responsible for telling the thyroid to release hormones. However, because the immune system is mistakenly telling the thyroid to produce more hormones than the body actually needs, the thyroid becomes hyperactive, leading to hyperthyroidism. Genetics play a significant role in this condition, with certain genes associated with a higher risk. Family history is also important. Having a close relative with Graves' disease or another autoimmune disorder increases your risk. Gender is another factor, with women being much more likely to develop the condition than men. Other factors that may contribute to the development of Graves' disease include stress, pregnancy, and smoking. Stress has long been linked to the onset of autoimmune conditions, including Graves' disease. It is thought that significant physical or emotional stress can disrupt the immune system, making it more prone to attacking healthy tissues like the thyroid. Smoking, on the other hand, not only increases the risk of developing Graves' disease, but also worsens its eye-related symptoms. Finally, we have pregnancy or recent childbirth, which can also increase the risk, as hormonal changes during these times can affect the immune system. Symptoms of Graves' disease. The most common symptoms of Graves' disease are related to the increased metabolism caused by excess thyroid hormones. These include weight loss despite an increased appetite, rapid or irregular heartbeat, and nervousness. You may also have anxiety, irritability, and tremors in the hands and fingers. Many people with Graves' disease experience heat intolerance and increased sweating. They may feel warm all the time and have trouble tolerating hot weather. Fatigue is another common symptom, which may seem counterintuitive given the increased metabolism. However, the constant state of hyperactivity can lead to exhaustion. Some people with Graves' disease also develop a goiter, which is an enlargement of the thyroid gland that can cause a visible swelling in the neck. This can sometimes lead to difficulty swallowing or a feeling of fullness in the throat. The eyes are often affected in Graves' disease, which is a condition known as Graves' ophthalmopathy or thyroid eye disease. Early symptoms include dry, gritty eyes, redness, and puffiness around the eyes. As the condition progresses, the swelling and inflammation can push the eyes forward, causing them to bulge out. This can lead to discomfort, difficulty closing the eyes, and even double vision. In severe cases, Graves' ophthalmopathy can compress the optic nerve, leading to vision loss. However, not everyone with Graves' disease will develop eye symptoms, and the severity can vary greatly. Sleep disturbances are frequent in Graves' disease. Many people have trouble falling asleep or staying asleep, which can contribute to fatigue and mood changes. Some individuals may experience muscle weakness, particularly in the upper arms and thighs. Changes in menstrual cycles are also common in women with Graves' disease. Periods may become lighter, less frequent, or stop altogether. In men, Graves' disease can cause erectile dysfunction or decreased libido. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Graves' disease. When a patient presents with symptoms suggestive of hyperthyroidism, the first step is usually a thorough medical history and physical examination. The doctor will look for signs like rapid pulse, tremors, and thyroid enlargement. Blood tests are crucial in diagnosing Graves' disease. These tests measure levels of thyroid hormones, T3 and T4, and thyroid-stimulating hormone, TSH. In Graves' disease, T3 and T4 levels are typically elevated, while TSH is suppressed. Additionally, tests for thyroid-stimulating immunoglobulins or thyroid-stimulating hormone receptor antibodies can help confirm the diagnosis of Graves' disease, as these antibodies are specific to this condition. Imaging studies may also be used in the diagnostic process. A radioactive iodine uptake test can show if the thyroid gland is absorbing too much iodine, which is a characteristic of Graves' disease. Thyroid ultrasound or thyroid scan may be performed to visualize the size and shape of the thyroid gland and to look for nodules. For patients with eye symptoms, an ophthalmologist may perform additional tests to assess eye function and determine the extent of eye involvement. Treatment for Graves' disease. The treatment of Graves' disease aims to stop the overproduction of thyroid hormones and alleviate symptoms. Antithyroid medications are often the first line of treatment. These drugs, such as methimazole and propylthiouracil, work by interfering with the thyroid gland's ability to produce hormones. They can effectively control the hyperthyroidism in many patients, but they may need to be taken for an extended period, typically 12 to 18 months. Some patients achieve remission after this course of treatment, while others may need ongoing therapy or alternative treatments. Beta blockers are often prescribed to provide rapid relief from symptoms like rapid heartbeat, tremors, and anxiety. While these drugs don't affect thyroid hormone production, they can significantly improve quality of life, while other treatments take effect. Radioactive iodine therapy is another common treatment for Graves' disease. This involves taking a single dose of radioactive iodine, which is absorbed by the thyroid gland and destroys the overactive thyroid cells. This treatment often results in permanent hypothyroidism, requiring lifelong thyroid hormone replacement therapy. While this might seem counterintuitive, it's generally easier to manage hypothyroidism with medication than to control the fluctuating hormone levels in Graves' disease. In some cases, surgery may be recommended to remove part or all of the thyroid gland. This option is usually reserved for people who cannot tolerate other treatments, or for those who have a large goiter that is causing difficulty breathing or swallowing. Like radioactive iodine therapy, thyroid surgery often results in hypothyroidism, requiring lifelong hormone replacement therapy. For people with eye symptoms, treatment may include medications to reduce inflammation and swelling around the eyes, such as corticosteroids. In severe cases, surgery may be necessary to relieve pressure on the optic nerve or to correct the position of the eyes. Stopping smoking is particularly important for people with Graves' ophthalmopathy, as smoking can significantly worsen the condition. The prognosis for people with Graves' disease is generally good with proper treatment. Many patients achieve remission or can effectively manage their symptoms with ongoing care. However, even after successful treatment, there's a possibility of relapse, so regular checkups are important. Now, we want to hear from you. Have you or someone you know experienced symptoms of Graves' disease? How did it affect daily life, and what steps have you taken to manage the condition? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.